maintain a urinary catheter for 10 to 14 days to prevent obstetric fistula. Okay, so techniques for impacted head during cesarean section: vaginal pushing, that's abdominal vaginal method. An assistant inserts a hand into the vagina to push the fetal head upwards while the surgeon extracts the baby. Reverse breech extraction: the surgeon reaches into the lower segment and potential for extension. A lower segment incision may need extension, that is J or T-shaped, to avoid excessive trauma to the cervix or bladder. Thank you. So we've gone through everything from how it presents to management. I honestly didn't know you could leave the catheter in situ for 10 to 14 days. Now I know. Thank you. So can we have Sijona anything prolongs labor? I've not seen anything. Na jana tulisema nini? We said something about, was it uterine atony and uterine rupture? We said uterine rupture is mostly in obstructed labor and then atony mostly in prolonged, right? Niskwe nilisahau. Okay, thank you. So do we CT or I wait for you guys to share something on prolonged labor? Prolonged labor and obstructed are their causes same? No, I don't think so. No, they're quite different. They're quite different. Alive, they're not similar. Do I wait for some evidence on prolonged labor? And we go to the next question. Carbitone. Ngoja. Oh my god. I'm lost. What are you guys talking about? Nona to Carbitone. Nini tunapeana. Obstructed labor is an example of prolonged labor amongst others. Nani mention Kiambo bado hupeana hata after induction. If you're induced, what's the rationale of not giving oxytocin for augmentation? Thanks, Eugene. So obstructed stroke, prolonged labor, failure of the fetus to descend through the birth canal in spite of good uterine contractions, either from physical or mechanical obstruction. Recommendation: educate all mothers on importance of ANC attendance, screen high-risk individuals for gestational diabetes, correct use and interpretation of labor monitoring tools for decision making. So etiology, CPD, occurs when there is a misfit between the fetal head and the pelvis. This means it is difficult or impossible for the fetus to pass safely through the pelvis. CPD may be due to small pelvis with a normal sized head, or a normal pelvis with a large fetus, or a combination of a large baby and small pelvis. Risk factors: on the maternal side, there's bony obstruction due to contracted pelvis, tumors of the pelvic bones, previous surgery or fractures of the pelvic bone, soft tissue obstruction due to one, uterus, which is impacted, subserous, pedunculated fibroid and or fibroids in the lower segment. The cervix, cervical dystocia, vagina, septal stenosis or tumors, ovaries, impacted ovarian tumors, and fetal, there's malpresentation and malpositions like persistent occipital posterior and deep transverse arrest, persistent mental posterior presentation, brow shoulder dystocia, large sized fetus, that's a fetus above 4 kgs and above, congenital anomalies like hydrocephalus, fetus ascites, fetal ascites. I've never heard of that. Fetal tumors, locked and conjoined twins, any multiple gestation where first fetus is not cephalic. So this guideline says they're saying, okay, obstructed aquina contractions, but something. Nani ameunmute? Wait, I'm seeing something here. Ni nini huwa tuna change from oxytocin to carbitocin? And why? What is that? Someone enlighten me, kwa sababu nimekuwa nikisoma evidences sijajua what you guys were saying. Heat stable carbitocin is given after delivery. 100 mcg IM within 1 minute after delivery of the baby and after confirming no second twin. Hii kabito ni ya nini? Carbitocin, sorry, doesn't require. Nataka mnaniambie doesn't require refrigeration, hata sijui ni ya nini. Ni ya nini na tunapeana wapi? O, ni cytotec tu. Ni kama oxytocin. So why are we substituting oxytocin? Na ni wapi tuna Kingly kungoja nikuwe enlightened, please. Ni kama oxytocin. Okay, tumepeana wapi? Oh, the storage is easier. Oh, third stage. Oh, third stage. Okay. Oh, now I get it. Okay. Because it's heat stable, like it doesn't need refrigeration kama oxytocin. Mm. Cytotoxic ni misoprostol ama? Yeah, nimeelewa. So amesema hiyo carbitocin inakuwa administered in third stage in place of it's just like oxytocin. It's a tonic. It's just like Sinjoina, imenipita cinnamon, but it's fine. Mshaniambia ni a third stage and we use it. Sasa sahi inatumika. That's the one being used right now. But do not use it to prevent PPH. Okay. Nimeisoma. I told you guys nikisoma kitu like it's hard for me to understand niki moderate. I prefer like when someone else is moderating. I get a lot. Sasa una umeniambia nimesoma na unaona nasema sijasoma. But it's fine. Si umeniambia ni a third stage. Okay, at least I know that. Zote bado zinatumika tu. Okay, ni sawa. Cinnamon unaweza ni nini hiyo like unaweza forward. Hey, Jamie. Okay, can we now go to the next question if there are no more? If no one else needs a clarification, that's all right. Augmentation. Oh, what's the difference between augmentation and induction of labor? Augmenting ni kwa like una fast like unataka increase like oh my god. Induction, we tujue induction. Induction unazianzisha kabisa. I'm still bad at explaining myself. Oh my god. Yeah, induction unaanzisha and then augmenting unaendeleza. Yeah. Yes, that's it. Induction you're inducing. Yes. And in augmentation ndio tunapeananga 540, 5 international units of oxytocin and 40 mgs of buscopan. Hiyo ndio ya augmentation, right? Induction, artificial initiation of labor. Okay. Induction, yeah, 540 ndio ya augmentation. Induction tulikwanga tunapeana cytotech. Ama hiyo ilikuwa tunapeana wapi? Ilikuwa ni 6 doses and then you place on the posterior fornix of the vagina, of the cervix. Okay, I'm trying to remember from my labor rotations. Sijui kama nawacha. Niyo, perfect. Na Hoffman solution, the dropwise release of oxytocin during augmentation. Yeah, huwa tuna infuse in NS, if 540 unaweka in NS kwa augmentation. Action is cytotech, augmentation, oxytocin. Yes, you're right. Exactly. First all ni 50 mcg per hour. Syrup chronicles of the vagina. Yes, exactly. And then there's Hoffman solution. Nakumbuka hizi vitu. It's been so long. But your PPH ni parectal. Okay. Okay, are we cool now? Can we now CT? But your foot ni buscopan to ripen the cervix. Now, to enhance is contractions. Yes. The MGs. Okay, yeah, the MGs. Thank you, Mariel. How do you calculate the drops of oxytocin infusion? Hormone solution. Nini anajua Hoffman, but najua iko na cytotech. Ama sijui nini kwa hapo ndani. But I think ni cytotech. Una mix na NS. Alafu iyo solution wanakunywa. Guy. Hey, nisikuwe nadanganyana. Aki someone confirm. Hoffman solution. I'm correct. Okay. Niju, it's been so long. Sasa just kumbuki vizuri, but najua. Alafu walikuwa napewa hiyo Hoffman solution for like how long? After how long? Distilled water. Exactly. Yes, it's distilled water. It is every 2 hours. Okay. It's distilled. Yeah, near induction. Your Hoffman solution. It's 8 doses 2 hourly. Nani cytotech and Msininyime hadi cities. Oh my god. And you're like 250 participants minus me. Mnanipatia 10 cities. Na sioni mwasomea evidences hadi my throat is dry. Okay, can I now get the next question? Thank you. Msininyime hadi cities za Kigai. Thank you. So, polarity is the term used to describe the neuromuscular harmony that prevails between the two poles or segments of the uterus throughout labor. Thank you. So, the next question, a mother comes to ANC at 36 weeks gestation with a history of fresh stillbirth and an abortion. This will be interpreted as para 0 plus 2 gravida 3, para 3 plus 0 gravida 2, para 1 plus 1 gravida 3, para 1 plus 2 gravida 3. You get 289, you guys 589. You're going with C. So this mother comes to ANC with a 36 weeks gestation with a history of fresh stillbirth and abortion. So para 1 plus 1 gravida 3. Okay. Kuna any contradicting answers? Miss Smile is going with A. Yeah, so tuko na an A somewhere. Pookie is also going with A. Okay, so this month tufanyeni pamoja ndo like tuko on the same page. Bini, hii ni gani? Let me see. Let me drop it hapa chini because it's too iko far sana. May. So A is para 0 plus 2 gravida 3. But it was a fresh stillbirth. So si hiyo inaifanya inakuwa para 1 ama? Jamani nimefanya nini? Naona tuambie ni yeye alikuwa na evidence. I shared an evidence. Ile swali asubuhi. I shared an evidence. Na sijui ilipotelewa. Nilitafuta sikupata. But yeah, in the morning we said kuna shoulder presentation. Someone shared an evidence yenye kuna shoulder presentation from Miles. Stillbirth ndio gani? Stillbirth, the fetus ina hey guy. Fetus inadai ikiwa kwa the uterus. Sasa una deliver a stillbirth. Ningoje, imesema ni fresh. Haijasema ni gani, but kuna kwanga na fresh and macerated. Ni hizo mbili. Nisikuwe nadanganya watu wa Kigai. So it was variable. Oh, sidanganyi. Kuna fresh and macerated. Okay. Macerated inakwanga imekaa kwa in utero for some time. Na features zinakwanga different za fresh and macerated. Thank you. So, a stillbirth from the evidence shared by Arel. Stillbirth, a baby born after 24 weeks gestation, but does not show any signs of life, any sign of life. And a fresh stillbirth, A baby who has died during the process of labor due to sudden complication. Macerated, this is a baby who has died before the onset of labor and has been retained for some time. At birth, the body has decomposed. Yeah, that's what I'm saying. There's a difference between a macerated and a fresh stillbirth. Mhm. Perinatal death refers to either stillbirth or neonatal death within the first week of birth. Perinatal means around birth. So yeah, that's the difference. So this means this neonate are viable. Someone was asking. So yes, it was viable. So that makes it atakuwa para 1. I think you're going to eliminate A if I'm not wrong. So do we all agree ni CTC? Can I get more cities to go to the next question? Abortion miliamwani before 24 weeks. In Kenya. No, in Kenya. Kuna in Kenya na kuna ya sasa ya nini? Ya huko kwingine ni 20 weeks. CTC, okay. Can I get the next question? It's 24 weeks. Abortion ni below 20 weeks. Yeah, kuna abortion and miscarriage, yes. Abortion ni how many weeks na miscarriage ni how many weeks? Viability. Abortion ni criminal. Mjaniambiani, abortion is intentional, miscarriage unintentional. So miscarriage is spontaneous aborting. What differentiates abortion from miscarriage is that abortion can be induced. Okay. So hatuwezi kuwa na nini? Abortion below 20 weeks, miscarriage above 20 weeks. But zote ni abortion. Period. Okay. Timeline ndo ina differentiate. So above 20 weeks, it's miscarriage, and below 20 is abortion. Periods. Okay. Next question. Next, onimwe ilikuwa imetumwa hapa juu. Hormone involved in milk secretion. We had a really long argument concerning this particular question. It was about secretion and production and letdown and everything. So I hope right now we're like atuta dwell on this question for long. So hormone involved in milk secretion is prolactin, progesterone, human placental lactogen, or oxytocin. Haraka tukisonga. So Cynthia going with D. And the rest, I can also see Riri going with D. So DA, so far DA. So let's see. A ni prolactin, D ni oxytocin. So let's get this right, okay? Prolactin ndo ya secretion. Wacha niwaambie kitu najua, alafu mtani correct if I'm wrong, okay? So prolactin ni ya secretion or production, okay? And then oxytocin is let down ama ejection. Okay, so like they'll use the words interchangeably to confuse you, but let down and ejection is oxytocin, and then production and secretion, prolactin. Okay, are we okay up to there? Exactly. Hata Manu ameifanyika kwa so easy. So prolactin production, that's PP. Prolactin production, okay? Oxytocin. Let's sit with the right answer now. Thank you. Can I now get the next question? So I hope you never forget that, okay? Ukiona hiyo swali unanikumbuka venye nimewaexplainia. Oh my god, did someone share some evidence? Guy, akipole, sijaona. Oh, it was about induced abortion. And thank you, Keter. You guys can go through it. So, 591, in Abs palsy, there is damage to the lower brachial plexus involving the seventh and eighth cervical root nerves. There is a damage to the upper brachial plexus involving the fifth and sixth cervical root nerves. There is damage to all brachial plexus nerve roots. There is damage to the facial nerve roots. So abs palsy. Let's not confuse between abs and clunkies. So you can see everyone is going with B. I don't see any contradicting answers. Is there any? No. B says there is a damage to the upper brachial plexus involving the fifth and sixth cervical root nerves and cervical 8 and C8 and T1, which is a clunky, right? And clunkies inakwanga the lower brachial plexus. Yeah. And abs ndo waiter's tip. So can we now CT? Ama mnataka more evidence? Lakini hata kama mnasema eti maswali ndio inajirudia, sio karatasi. Yeah, yes. Na damage to the facial nerve ina cause nini? Inakosingi nini? There is damage to all brachial nerve roots. Mbona mtu akiuliza si ni gani? Bell's palsy. Yeah, okay, yeah. Bell's palsy. So you need damage to the facial nerve. Bell's palsy. Thank you. Na hiyo si ni gani? I think any clunkies Miss Smile. Kama ni clunkies ni from C8 to T1, and it's the lower brachial plexus. Total brachial plexus. Okay. Hiyo ndo C. Njoki, Rita, and Mwende. Okay. Total brachial plexus. Thank you. So can you now get the next question? $592. So late neonatal deaths are deaths occurring after 24 hours of birth, up to 1 year after birth, 14 to 28 days after birth, 7 to 28 days after birth. So you can see all of you going with D. Oh, so dear. So within 7 days is early neonatal death. That's 0 to 7 days. And then 7 to 28 days is late neonatal death. So let's see to that question. If there are no more questions, kama kuna mtu anataka. Perinatal is 28 weeks gestation up to 7 days of life. I'm after birth here. Next question. Features of dichorionic twins include 2 amnions, 1 placenta, 2 placenta dizygotic, 1 amnion, 1 placenta dizygotic, 1 amnion, 2 chorions, 1 placenta. Features of dichorionic twins. So 593, you guys are going with B. I remember someone had explained this. Was it Stacy? Ni Stacy. Why not confused? Was it Stacy or Tracy? Na siku hizi simuoni. Chorionic talk about placenta here. So types of twins. We have diamniotic dichorionic twins. That's 2 placentas. Diamniotic monochorionic. Then monoamniotic monochorionic. Wanna share the placenta. Diamniotic dichorionic fused. I'm a fused. Okay, dichorionic. Thanks, Jada. Thanks, Mwenge. So, dichorionic. So, relationship between zygotic and chorionicity. Zygosity and chorionicity. So, dichorionic, 2 placentae may be fused, and 2 chorions, 2 amnions. These twins can either be dizygotic or monozygotic. So that's the chorionic. Monochorionic, 1 placenta, 1 chorion, 2 amnions. 1 amnion is monoamniotic. Twins is very rare, okay? These twins can only be monozygotic, okay? So monozygotic meaning, so in 1/3 of monozygotic twins, the placenta will have 2 chorions and 2 amnions, and either fused placentas or 2 separate placentas. That's dichorionic, which is indistinguishable from the situation in dizygotic twins. With monozygotic twins, the type of placenta produced is determined by the time at which the fertilized oocyte splits. Okay. So from more evidence from Yeyundwa. So I think it's similar to what I've just read, right? So these twins in the chorionic, these twins can be dizygotic or monozygotic. And in monochorionic, these twins can only be monozygotic. Haya, sasa zile mambo na fraternal and whatever twins. Naonanga Manu akiita nani sijui my fraternal twin. Manu, can you explain? Wenye hawafanani mostly dichorionic, diamniotic. So wale wenye ni identical twins ni monozygotic. After vasectomy, does ejaculation occur? Yes, of course. So monozygotic ndo identical, right? Identical ni monozygotic. Dizygotic ndo wenye ni you can have twins but moja is a guy and another one is a lady, right? Ama a girl and a boy. For dizygotic. Dizygotic can have different studs. Guy, paternal or identical ni monochorionic monoamniotic. Fraternal ni unidentical. Okay, so fraternal ndo mwenye naweza sema one can be a girl, another one a boy, but ni twins. Kama wale vijana wa Gashagwa, I don't know them. Okay, thanks Cinnamon. So you guys have understood the difference. Fraternal ni unidentical and they can be of two, these are like different genders. But paternal ama identical ndo wao monochorionic monoamniotic twins. Hey, Jamini Muhim, stop. Inigani. It's let me try to read this evidence shared by Genesis. So dizygotic or binovular twins develop when two separate oocytes are fertilized by two different spermatozoa. They are often referred to as fraternal or non-identical twins. Okay, they are no more alike than any non-twin brother or sister and can be the same or different sex. So that's fraternal. In any multiple pregnancy, there's a 50-50 chance of a girl or a boy. Half of dizygotic twins will be boy girl pairs. A quarter of dizygotic twins will be both boys, and a quarter both girls. Okay, thank you. So now you know the difference between fraternal and paternal twins. So dizygotic ni fraternal or non-identical twins. Fraternal. Okay. Oh my god. Alive, umeacha tu hiyo swali uanguke. It's not that hard. It's not that hard. Anyways, superfecundation, different men, superfetation, same one, different sexual escapades. Oh my god. How will you have sex? Okay, sawa, achani nyamaze. So superfecundation, two eggs are fertilized by sperm from different men. Mmoja wa mrasha mwingine. Oh my god. You guys. Then there's superfetation, same man but different time zones. Okay. Hey, okay, can you now get I don't know women. Hey Jamini. For superfecundation, that's crazy. That is crazy. That's insane. Oh god. Okay, can I now get the next question? I hope you're okay now. With fraternal, paternal, superfecundation, superfetation, hizo zote. Dizygotic, dichorionic, monozygotic, monoamniotic. Hey Jamini, nothing will finish me. Can you now get the next question kindly? Did you guys see it? amkunipatia cities to that question. Give me cities, then go to the next question. Jamani, simnipatie cities zenye mna city nayo aki. Mshasahau hadi answers. Hata kama nani ananiambianga na kwanga na amnesia. That person has a special seat in hell. Sikukumbuki wewe ni nani, but nitakukumbuka tu. Next question. Yeah, there's someone who told me niko na amnesia. I forgot like nilisahau nafaa kumwederate. Hey, Jamin. It's a lie. I'm sina amnesia. Okay, let me read the next question. While conducting normal delivery, following the extension of the head, the midwife should assist in lateral flexion of the head, await the restitution of the head, await external rotation of the head, assist in the external rotation of the head. While conducting normal delivery, following extension of the head. $594B. Oh, sorry Muffin. Sikuwa nimeiona. So as you guys attempt that question, let me read this evidence shared by Muffin. So superfecundation, fertilization of two different ova released in the same cycle by separate acts of coitus within a short period of time. And then superfetation, fertilization of two ova released in different menstrual cycles. The development of one fetus over another fetus theoretically possible until the decidual space is obliterated by 12 weeks. Okay. Fetus compresses. It is a state which occurs if one of the fetuses dies early. The dead fetus is compressed with the membranes of the living fetus and the uterine wall. It may occur in both varieties of twins. Okay, that's new. I didn't know that. Thank you, Muffin. So 594, you guys are going with B. Uncle Drew, number your work. Mbona mjamdunga macho? What's the difference between B and C? So naona kuna B and C. B is await the restitution of the head, and C is await external rotation of the head. Okay. I see an evidence shared by someone here. That's Arlo. So labor mnemonic. Every doctor friend in Egypt eats raw eggs. Okay, so meaning E for engagement, D for descent, F for flexion, I for internal rotation, C for crowning, E for extension, R restitution, I internal rotation, E external rotation, L lateral flexion. Okay. The question was asking about what follows the extension of the head. While conducting normal delivery, following the extension of the head, the midwife should. So after, let me see, extension, copy extension. Extension. After extension, it's restitution, according to this evidence shared by Arlo. So there are They are here in step-by-step explanation. So engagement by parietal diameter passes pelvic inlet. That's zero station. Descent, downward movement of the head through pelvis. Flexion, chin moves to the chest to present smaller diameter. Internal rotation, that's the head. The occiput rotates anteriorly towards symphysis pubis. Then crowning, head remains visible at the valva without receding. Extension, the head extends under the symphysis pubis and is delivered. Then restitution, head turns 45 degrees to realign with shoulders. Internal rotation of the shoulders rotates into AP diameter. Sitaki kusema kitu ipo kwa akili nisikuwe nadanganya. Into external rotation, head rotates as shoulders align, then lateral flexion, that's expulsion. The body delivers by lateral bending. Okay. Thank you for that. Thanks. You wonder, this is twin to twin transfusion syndrome. Can be acute or chronic. The acute form usually occurs during labor and is the result of blood transfusing from one fetus donor to the other recipient through vascular anastomosis in a monochorionic placenta. Both fetuses may die of cardiac failure if not treated urgently. Okay, thank you. So nipatieni CTC, nimeshawasomea hiyo nini? The evidence. External rotation of the head is when the shoulders are rotating internally. Every decent family in Europe eats eggs. Yeah, ndio pia mimi nilikuwa najua. Sijuangi hiyo ya sijui FD something when I'm confused. So CTB, thank you. So next question. Mimi mwezi nipatia 100,000 CTs. Akina venye nimekimbia ndo nisi. Hata kama nimechelewa kijamini. Hata kama I was late by some minutes. See, I'm here. Thank you. Thank you. Thank you. No. Yes. Oh, yes, I am. I'm very guilty. So in bridge delivery, low set maneuver is applied in extended legs, extended arms, stuck head, extended head. Araka raka 595. 595B. Love sets. Inakwanga ya kudeliver the extended arms. Haya. Mnipatie CTs, then niwaulize hizo zingine. Thank you, Morphine. So delivery of the head is Burns Marshall. Second stage with extended leg. That's in Frank. Pinard. Extended legs ni Pinard. Extended head. Maurice Melivate, yes. And extended arms ni love set maneuver. Mm-hmm. Love hug, yes. Yashisha alitufunza hizi vitu oi. Ni sijui ningekuwa wapi. Where would I be? Mtu explain technique kindly. Kuna mtu mwenye ako na like an evidence. Someone invite future billionaire. Kuna mtu like ako na like an evidence and you explain like how to do them or something. Anyone with an evidence, we go through them. Mhm. Nani ameunmute? Someone, oh my God. So, I can't just share anything. Thank you. Thank you, Harvard. Harvard dropout. So, Burns Marshall maneuver. When the hairline appears, grasp the baby by the feet and hold the stretch, applying sufficient traction to prevent fracture of the neck. Then move the feet through an arc of 180 degrees until the mouth and nose are free at the vulva. At this stage, ask the mother to pant through an open mouth, breathing out the head. 1 or 2 minutes should elapse to allow slow delivery of the vault of the head to prevent tentorial tear. Then the extended head. So Burns Marshall near after coming head. After coming head, ikona. Oh, this is a continuation. So position hands and fingers to extract extended head. Put the baby astride your left arm with the palm supporting the chest. First and third finger of left hand should be placed on the malar bones to flex the head. Middle finger in the mouth. Well back. Thank you. Oh my God. Is there a problem with the nets? Nona? There's someone saying how any chat water ni kama like ako out. Oh, Manu invited water. Okay, thank you. So, then first and second hand, right hand fingers should be hooked over the shoulder, pulling moderately in a downwards direction. So ndio hiyo, there's words watu wenye wanataka kuona ndo wajue venye inafanywa. There you go. Then controlled traction is exact area appears before the appearance of the nape of the neck. Upward traction at this level will inflict fracture of the neck. Instruct the mother to pant. Exact traction in upward direction to allow for the birth of the head. Nose and mouth are free. Your intervention will clear the airway. The vault is delivered slowly. So kuna oncoming head and after coming head. After coming head is Maurice Milivate, and then oncoming is Burns Marshall. Someone correct me if I'm wrong. Muffin, is that right? Ama nimesema vitu zangu. I'm right. Okay. Oncoming, Burns Marshall, and then after coming is Maurice Milivate. Can we now see? Nipatie CT if you're okay. Oh, sorry. Like inamaanisha after coming head. Oh my God. Aki nikiwa nimefanya hivyo tena bado. Oh my God. Hamwelewi. Haieleweki. Nini inafanya isieleweke? Okay. Me explain. Oh my god, I'm the wrong person to explain because I honestly don't know how to explain. Like I don't know how to explain myself or anything. So if there's someone who is like anajua vizuri and would like to explain, no, not like akinaweza explain in like a different language. I'm just like explaining is just not my thing. I don't know how to explain. Like ndo maana hata sipendi mambo na long answer question. Sijui like sijuangi explain. I don't know how to explain myself. That's the problem. New guidelines, however competent you are, all mothers diagnosed with breech are booked for CS. Consider medical legal issues. Okay. After coming head is extended head. Oncoming is Nadine explain like you're in the oh my god. Oh how I get it. Okay, let me see if I have the I had some ninis, some some pictorial evidence yenye ilikuwa inaonyesha maybe that will help. Acha nione kama bado niko nazo. Let me see. Maybe that will help. Actually, sijuangi explain. I really try, but I don't know why. Sijui explain. Okay, maybe this will help. Wacha nione. Like mkiangalia maybe like itaweza kufanya understand like hizo steps. So let me send this to you guys. Hey, jamini yake. Uh, so Bands Marshall tumesema ni ya oncoming, right? Ebu try like angalieni hii picture like mwangalie venye wanafanya muone. Wacha niwatafutie ya Maurice Nilivate. Like kuna unaona like kwenye A iko like unafuatanisha tu hivyo from A to D. Let's now see. This is better actually. This one looks a bit more um this I think you'd understand more. Oh, Eh, jamani, aki mbona sipati. When you need it most, that's when you natafuta sipati. Uh-huh. Well, how about I feel like Indo inaitwaje? Let me share this with you guys. Join, maybe this will help you understand better. Hakuna mtu mwenye ako na nini. Mmeona iwe nini? Wacha nionyeshe sasa ya inaitwaje. This pia ni Buns Mashal. Then this is Maurice. Like sijui kama ina make any sense. I wish I could like explain it to you guys, but sasa hii sasa ni ini Maurice hii ya mwisho. Mnaona venye like ni different venye ana place hadi hizo hands. Maurice, yes, Keter, yes. The last one. Like ukisoma like hizo nini? I'm not. Are they still? Do we still do this maneuvers? By the way, I'm not sure. Nani mwenye sahi ako like? Oh, ilikuwa what are this after coming and oncoming? Kuna mtu wake anaweza explain? Muffin, where are you? Muffin, please. Muffin, Shishi, nani mwingine? Jungle Boy. Kwani Muffin ametoka? Si alikuwa hapa tu sahi. Jackie Mimiakisi. Muffin, I can see Muffin is in the chat. Muffin, please just unmute and explain, please. Nimemute.
Okay, thank you so much. I hope mnanipata. So I don't know what the point of clarification because ni kama tuko confused kidogo. So tumepata maneuvers. So which is the point of tutaanzia wapi? After coming heads in the same bado na Mauritius Melly. Yeah? Yes, good people. Sindio? Unanisikia ama niko zangu? Sindio bado Mauritius Melly. So just from the point of presentation, how do you deliver? Wacha tuende pamoja. Okay, Salisha Bridge. Thank you so much. Wacha nianzie hapo. Kuna mtu anasema Salisha Bridge presentation. Sawa. After coming head ni sini Mauritius Melly bado. Love set, hugging motion. Tumesema what do they call? I mean love set arms. So after assuming you are delivering, I mean you are conducting after coming of the head ni Mauritius Melly maneuver. So the so-called was also the extended head, right? So because but Marshall need delivery of the head. So you are having a client with a bridge presentation. Second stage of labor. Though nowadays we don't. Okay, even if those factors favors, even if you assess and some factors favors the bridge presentation, it's not recommended. But let us just assume you are in the second stage of labor and you are conducting a bridge delivery. I know most of you have conducted bridge. So what is the first thing you do? Let us get the picture itself. Huh? So don't even type. Type mambo mengi. Wacha tu let us just brainstorm and also get that picture. You are in second stage of labor. So which part present? Yeah, you are in labor. So which part present first? Let us just engage in that context. Which part present? You are conducting a bridge. Both buttocks. Thank you so much. Buttocks, right? The buttocks. Yeah. So we have those diagnostic in second stage of labor. I mean, prior to second stage of labor. So that to also to confirm, though we also have the also diagnostic to confirm breach, but I don't want to go to those diagnostic. Lay a finger, you prick them in the nostrils, I mean of the new, I mean the baby. But let me just say that the part that present the buttocks, right? So deliver the buttocks. Okay, the buttocks is here with you. What next? What next? Mpaka kichwa itoke. Deliver the legs. The legs, eh? Either right or left. Yeah. How do you deliver the legs? One person, maybe. Extended legs, yeah. One leg can extend. Yeah. Remember, it's bridge, right? So we are saying leg now. We are talking of legs. Yeah, thank you so much. So you can deliver just one leg first. Let us just get that image. You are in a labor ward, right? You deliver one leg. Then you, after delivery of the one leg, and then you deliver the other one. What remains now? The buttocks are out. The two legs are out. What remains? Ni nini iko ndani? What remains? The heads and the bodies. Ndio. Si ni miguu tu bado kila kitu iko ndani. Right? Arms, everything is inside. Si ndio? Kumbuka ni legs tu na tumetaja maneuver. Head and the arms and everything is inside now. Then remember now the baby is in a hanging assume the baby is in a hanging motion, right? Because the body itself, the whole body iko ndani, ni miguu tu ndio imetoka na sitaki kusema haga. I mean, thank you so much. Somebody is saying lobset, right? The lobset maneuver. So you deliver arm. That is the next step. You deliver the lobset maneuver. We'll be thinking of lobset maneuver. That baby in the utero, I mean the hanging now. The legs are outside already. Umeweka. How do you know how to deliver the arms? Do you know how to deliver pictorial? Just a pictorial presentation. I think you get image of what we are talking of. Now, how do you deliver now arms? Your arms. Yes, you see either one of the left or the right, and then what do you do? How do you deliver the arms? Before 20 even to the body and the head now. So somebody has just sent us something here. Thank you so much. I want to refer to this picture, the above picture here. Yeah, the arms, how you deliver arms, because delivery of the arm is very, very important to avoid some. What is the implication? After delivery of the leg, please be very careful because that point matters a lot now. Any careless, whatever, or any incompetence, you might cause a long-term effect to that baby. So how do you deliver the arms now? You see, I think you get to some resort. I think you get the pictorial part of the how you deliver the arm. And then you rotate. Thank you so much, Sinamo. Yeah, you rotate, right? And you rotate in such a way, what do you call the diameters of the whatever, so that you create adequate diameters. Remember, your interest when you deliver bridge presentation, diameters of the pelvic are adequate to enhance every part to come in. That's your main goal. So you have to twist, like the way Sinamo is saying. I mean, anyone who is saying you rotate, right? And rotation, so that at least the angle of the symphysis pubis, is it symphysis pubis or what do they call? Those angles that's your aim. Now, after you have delivered the arms, somebody say you rotate, yeah. Adequate space for arms delivery. What next? You have delivered one, sweeping the other one. You have delivered two arms. What is hanging inside? Ni nini imebaki huko ndani sasa? What remains inside? The head and the body, right? The head and the what? And the body. Sindio? The arms ikotoka, ni body, sorry, ni head. It's head only. Yeah. Some part of the whatever and the head. Now, yeah, head peke yake, exactly true. Yeah, body iko out, true. When you are talking of arms delivery, meaning the body ishatoka, ni kichwa imebaki. Now this body is hanging. I mean, remember the baby is now. Assume matter you have not taken. I mean that you get that image like shipping around the whatever the nostril to support on the posterior part of the. I mean, or the lower part of the newborn. So before even hanging now, remember the baby is now hanging. The head is hanging inside. So what do you do? Which maneuver will you be thinking this? I mean, in this context again. The maneuver that remains. The maneuver that remains, the Mauritius Melly and the thank you so much. Yeah. So your aim still here is to make sure, because will you push? Utasukuma tu utoe tu hivyo ati juu kichwa imebaki. What do you do? So that's why these maneuvers are so important. That's why we call them maneuvers. What happens? So utafuruta mtoto. Yeah. So the next maneuver now, the head is remaining. The next maneuver. Remember, you have just delivered the arms. The next maneuver. Is it Ban Marshall or the Mauritius Melly? Ban Marshall. Yeah. Is it Mauritius Melly or the Ban Marshall? Somebody to invite. Was it true? Is it Ban Marshall? Because I want us to get that concept of after coming. Because when you said after coming of the head, Mauritius Melly. Not how to know, just that is the techniques. So which ones come? Because extended and oncoming head. So we'll be thinking of what? Mauritius Melly, right? Yeah. Then the last one now. Remember how you are supporting the baby when you talk of Mauritius, right? And then you still rotate in the same angle that we are saying. Kichwa tu peke yake sasa ndio imebaki. Unatoa aje kichwa? How do you? Inana up, was it up inside or upward? Up outside. What do they call? It's like what can I say? Like you after the Kiingereza inapotea. Like the angles of the simple pupils, right? You have rotated and the baby is now accommodating the head of the baby. Is fully accommodating the angle, right? So you push it in a what manner? I'm trying to get the last maneuver as you push the head outside. The last one. Yeah, this one on this right. I mean on the left. This this image. There's this image sent by who? By Kasun. Kasun, hi. Na uko mrembo. So this image on this right, on this edge, I hope you can see the baby how it's being supported on the nostril, on the posterior part, and then the head after the full accommodation on the pelvic outlet, right? And then just una push in that context, alafu mtoto anazaliwa. Are you getting? I hope you are done with the. Yeah, sorry, Sinam. I hope you are done with the. Yeah. I hope now you are getting instead of just referring to the notes and whatever. Yeah, thank you. Back to you, moderator. I hope you add some 0.01 contribution hapo. Back to you, Nadine.
Thank you, Muffin. So I hope we're now okay. Stan has been typing for the past 5 minutes. Nangoja amalize hamalize. So I hope we're now fine. We're good to go. So after coming means the head is being delivered after delivery of all the other parts. That's the butt, legs, body, and arms. Yeah, yes, we can. Let's do that. Tunini tuangalie YouTube tuone. Yes, time is up. Our time is up, guys. So I hope na plus kesho ni midwifery. Kuna midwifery sessions kesho, both abnormal and normal unit wise. So make sure to not miss. Okay. So 4 p.m. and 10 unit wise. 4 p.m. and 10. There's a timetable. There's a timetable up. I think imepiniwa somewhere here. So thank you guys for being super active. And thank you, Kasun. I think Kasun was the one forwarding questions, if I'm not wrong. And who is updating this questions? Nilifika kama mmeanza. Forgive me. I'll try to be early next time. Nani ndo alikuwa ananisaidia? Thank you though. Ni nani? Is it sijui yake ni nani ndo alikuwa an update questions. But thank you so much. And thank you guys for sharing your evidences. Indini sasa unit wise. Shishi is the one taking us through. And bye. I'm gonna end the chat. See you guys.